You do everything right. Early bedtime, no screens, blackout curtains. You've read all the advice, followed every tip, and made your bedroom a sanctuary for sleep. You wind down with a book, avoid caffeine in the evening, and even keep your room cool and quiet. You're committed to getting the rest you need, and you make it a priority every single night. Yet despite your best efforts, you get 7 or 8 hours of sleep, but still wake up exhausted. The alarm goes off, and instead of feeling refreshed, you feel like you've barely slept at all. Your body aches, your mind feels heavy, and you wonder what you're doing wrong. This isn't normal, and it's not just aging or stress. It's not simply a part of getting older, and it's not something you should just accept as your new reality. There's a deeper reason behind this relentless tiredness. Persistent fatigue is your body's way of waving a red flag. It's a signal that something important is being overlooked. Your body is trying to tell you that rest isn't reaching the parts of you that need it most. It's not just tiredness, it's brain fog, irritability, and lost joy. You find it hard to focus at work, you snap at loved ones, and the things that once made you happy now feel like chores. Life feels heavier, and you can't remember the last time you truly felt energized. Coffee doesn't help, and you're told it's just perimenopause or a busy life. Friends and even doctors might dismiss your symptoms, chalking it up to hormones or stress. But deep down, you know there's more to the story. But what if the real problem happens while you're asleep? What if the hours you spend in bed aren't truly restorative because something is silently disrupting your rest, night after night? There's a silent energy thief, often undiagnosed, that sabotages your rest. Obstructive sleep apnea, Oregon OSA. This condition can cause your breathing to stop and start while you sleep, preventing your body from reaching the deep healing stages of rest it desperately needs. OSA is frequently missed in women because it doesn't fit the classic stereotype. Many people think of sleep apnea as a problem for older, overweight men, but women, especially in midlife, can experience it too, often with different symptoms. Your exhaustion could be a symptom of a treatable disorder. With the right diagnosis and support, you can finally get the restful sleep you've been missing and start to feel like yourself again. It's time to stop normalizing this level of fatigue. You deserve to wake up feeling refreshed, not defeated. Don't let anyone tell you that constant exhaustion is just part of life. Understanding the real cause is the first step to reclaiming your energy. Learn about your options, ask questions, and advocate for your health. You have the power to change your story. Let's pull back the curtain on this unseen thief. It's time to shine a light on what's really stealing your energy, and take back your nights, your days, and your life. Obstructive sleep apnea is a surprisingly common but often overlooked sleep disorder that can have a profound impact on your health and quality of life. It happens when the muscles in your throat relax too much during sleep, causing your airway to become partially or completely blocked. This blockage interrupts your breathing, sometimes for just a few seconds, other times for much longer. When this happens, your brain quickly senses the drop in oxygen and jolts you awake, often so briefly that you don't even realize it. This can occur dozens or even hundreds of times every single night, leaving your body in a constant state of stress. Even though you may not remember these micro-awakenings, you definitely feel their effects. You wake up feeling unrefreshed, groggy, and exhausted, no matter how many hours you spent in bed. Your body is trapped in a relentless cycle of oxygen deprivation and fragmented sleep, making it nearly impossible to reach the deep restorative stages your body and mind need. But sleep apnea isn't just about feeling tired. The repeated drops in oxygen and constant sleep interruptions put enormous strain on your heart and brain, increasing inflammation and stress hormones throughout your body. If left untreated, sleep apnea can dramatically raise your risk for high blood pressure, heart attack, stroke, and even type 2 diabetes. It can also worsen existing health conditions and make it harder to manage your overall well-being. This is not just harmless snoring or a minor inconvenience. It's a serious medical condition that demands attention and care. Ignoring the symptoms of sleep apnea is like ignoring chest pain or any other warning sign from your body. The risks are real, and the consequences can be life-altering. Chronic fatigue, morning headaches, and trouble concentrating are your body's way of sounding the alarm. These are not just signs of a bad night's sleep. They're signals that something more serious may be happening. Caring about sleep apnea means taking steps to protect your long-term health, your energy, and your ability to enjoy life to the fullest. It's about safeguarding your heart, your brain, and your future. Addressing sleep apnea can help you reclaim restful nights and brighter days. Understanding the gravity of obstructive sleep apnea is the first step toward taking control of your health. Don't dismiss the signs. Listen to your body, talk to your doctor, and take your symptoms seriously. Your future self will thank you. The classic sleep apnea patient is a loud snoring man, but women's symptoms are different, and often missed. Many women don't snore loudly, or at all. Instead, they may have upper airway resistance syndrome, milder, but still disruptive. Women often feel unrefreshed, fatigued, and drained, not just sleepy. Symptoms like headaches, insomnia, depression, and anxiety are common, and often misattributed to menopause or mental health. Medications like sleeping pills can make things worse by relaxing throat muscles. Recognizing the unique symptoms in women is critical for proper diagnosis. Hormonal changes in perimenopause and menopause directly impact your airway. Progesterone and estrogen help keep your airway open. As these hormones decline, your risk for sleep apnea rises. Progesterone stimulates breathing. Estrogen maintains muscle tone in your airway. After menopause, women's risk for sleep apnea nearly matches men's. Physical changes like increased neck fat further narrow the airway. The loss of hormonal protection plus anatomical changes create a perfect storm. This isn't just a coincidence, it's biology. Menopause is a major turning point for sleep-disordered breathing. Understanding this link is key to getting help. Weight isn't the only risk factor for sleep apnea in women. Anatomy matters. A small jaw, large tongue, or narrow palate can shrink your airway. Family history is important. Genetics play a role. Hormonal changes unmask these risks in midlife. Conditions like hypothyroidism, PCOS, and chronic nasal congestion also increase risk. It's not just about weight, it's about your unique biology. Share your family and health history with your doctor. Know your risk factors to get the right diagnosis. Sleep apnea in women whispers. Learn to listen. Chronic insomnia, frequent night wakings, and morning headaches are key signs. Waking with a dry mouth or sore throat. That's a clue. Mood changes, irritability, and brain fog aren't just menopause. They're signs of poor sleep and low oxygen. Nocturia, waking to urinate, can be linked to apnea. Restless legs, night sweats, and a racing heart on waking are other red flags. These symptoms are not random. They're pieces of a puzzle pointing to sleep apnea. Don't ignore them. Your body is trying to tell you something. When you visit your doctor, simply saying "I'm tired" often isn't enough to get to the root of your problem. Instead, be as specific as possible about what you're experiencing, and don't be afraid to repeat yourself or push for answers if you feel unheard. Many people, especially women in midlife, find their concerns dismissed or minimized, so persistence is key. One of the most effective ways to advocate for yourself is to keep a detailed sleep and symptom diary. Each morning, jot down how many hours you slept, how you felt upon waking, and track your energy levels throughout the day. Note any patterns of fatigue and record when you feel most exhausted or alert. Don't forget to include other symptoms that might seem unrelated, like headaches, brain fog, night sweats, or trouble concentrating. These details can help your doctor see the bigger picture and connect your symptoms to possible underlying conditions. Bring your notes to your appointment and share them directly with your doctor. Say something like, "I'm concerned I might have sleep apnea or another sleep disorder." This shows you've done your homework and are serious about finding answers. Don't wait for your doctor to make the connections for you. Sometimes you need to connect the dots yourself and clearly state your concerns. If you suspect a specific issue, mention it directly. If your doctor seems to brush off your concerns or suggests you're just stressed, stand your ground. Say, "My symptoms are severe and I want a sleep study to get to the bottom of this." Being calm but firm can make a big difference. The gold standard for diagnosing sleep disorders is a sleep study, which can be done in a specialized lab or sometimes at home with portable equipment. This test is essential for getting accurate answers. During a sleep study, your breathing, oxygen levels, heart rate, and sleep quality are all monitored throughout the night. This data provides a clear picture of what's happening while you sleep. The results will show exactly how many times you stop breathing per hour and whether you have sleep apnea or another sleep disorder. This information is crucial for getting the right treatment. If your doctor offers sleeping pills instead of investigating further, don't settle. Insist on a proper sleep study and thorough evaluation. Medications may mask symptoms, but they won't solve the underlying problem. Remember, you deserve real answers, not just a quick fix. Ask questions, take notes, and make sure you understand every step of the process. Your health is worth the effort. Getting a diagnosis is the first step toward real relief and better sleep. It can be a huge weight off your shoulders to finally know what's going on and how to address it. Don't give up until you get the answers you need. Keep advocating for yourself, schedule follow-ups, and remember, you are your own best health advocate. A sleep apnea diagnosis is empowering. You can finally fight back. CPAP is the most effective treatment for moderate to severe cases. Modern CPAP machines are smaller, quieter, and more comfortable than ever. Many women feel dramatically better after just one night. For mild cases or CPAP intolerance, oral appliances made by sleep dentists can help. Positional therapy and lifestyle changes, like weight loss, avoiding alcohol, and quitting smoking, are also important. Even modest weight loss can make a big difference. Hormone therapy may help some postmenopausal women, but it's not a cure-all. The goal: find the right combination for you. Restorative sleep is possible. Take action and reclaim your energy.